Testing 1, 2. Good.
And Bill Richards says hi.
Okay. All right. Okay, let's go ahead and start. Okay. For all of you, we have a handout in the back. It's on zinc deficiency. So if you have not gotten the handout, it's back there for you. Some of you have written down questions for me to try to take on. And the question is, does boron help with diabetes? The answer is no. We don't know of boron helping with diabetes. I've not seen any articles on that. Some of you have asked where we can get boron from. The village market here will probably have boron 2 or 3 milligram tablets. They do make a 30 and a 75 milligram tablet with a company called Hakala Research Labs. And we've got their cards here. So if any of you want some of these cards, would you just walk up and down and pass them out? And you can order some of the cards. So the question is, did you have a baseline DEXA bone scan done when you were younger? How did you know that you had lost a half an inch? Well, that's a real simple one. I just measured myself. But I've always been 5 foot 11 and a half inches. And at age 40, I knew I was that. At age 45, I was 5 foot 11 inches. So I lost a half an inch in 5 years. And so that I was in the early phases of osteopenia, which would be the early forms of osteoporosis. My skeleton was shrinking. And so we basically at that point started me on 30 milligrams of boron per day. My wife developed problems with osteoporosis, and her skeleton was just going down the drain. And we started her on 30 milligrams a day, and her skeleton went like this. It leveled out, but it didn't reverse it. At 75 milligrams a day, we took her to the level of boron that they would be taking if you lived in Turkey. And at 75 milligrams a day, her skeleton just slightly started coming up. And then I took her to the level of boron as if she were living in Western China, 150 milligrams a day, and all of a sudden her skeleton went like this, okay? So she's got an extremely powerful skeleton at this point. Her skeleton, we had to do a bone biopsy on her a few years ago, and the hematologist thought, I'll just put this little screw in there and take a biopsy of the bone, and I'll be in and out of there in less than 10 minutes. Well, 30 minutes later, he's still trying to get a chunk of bone out of there because her skeleton was so powerful. And she's here to prove it. So, she's got the skeleton of a younger woman at this point. But we reversed the hardening, the osteoporosis at 150 milligrams. So if you have, if you're like 70, 80, 90 years old, you might want to start at 75 milligrams. And if your skeleton is still going down, we can go up in dose. But if your skeleton's getting better, we stay right at that dose, okay? No, because it's water soluble. So if your body can't use it, you'll urinate it out, okay? So that the thing is that the Chinese have taught us that you can take at least 130 milligrams and there be no problem. Toxicity, where is toxicity with boron? 6,000 milligrams a day. So none of you are going to get that high. So 6,000, but many of you can do the 150 milligram if you need to because of severe osteoporosis if you had to, okay? So that, but we can produce some pretty powerful skeletons. Now, the main drug out there for osteoporosis is called bisphosphonates, Fosamax, drugs like that. And the bisphosphonates have now been proven to be poisonous to the mandible, to the jaw, and some of you are losing your jaws because of exposure to that particular product to, quote, reverse your osteoporosis. How many of you know of a guy by the name of Toulouse-Lautrec? What was so famous about him? He was a painter in France and Paris and so on. Lautrec developed a medical illness that at age 13 he was playing and he fell and he fractured his femur right smack in the middle. At age 14 he fell on the other femur and fractured it in the middle. Lautrec never grew taller than 4'2" tall, okay? Now, the bisphosphonates that they now have for treatment of osteoporosis, those bisphosphonates induce the exact same medical illness that Toulouse-Lautrec had as a genetic disease, okay? Saying that at 13 years from exposure to the bisphosphonates like Fosamax, we were expecting to see an increase in fracture rates. And sure enough, right on the cue, on 13 years of exposure to Fosamax, we started seeing people who would be riding in a subway car and they would be shifting their weight like this, and just a shift in weight on the femur would fracture the femur right smack in the middle. Osteoporosis, when you fall, you fracture the hip up high. These people, they fracture their hips, their leg right smack in the middle, just like Toulouse-Lautrec. And now the FDA sits there and now this is the warning. The FDA released a statement about 2 years ago that said any patient taking medications, quote, in the bisphosphonate family for treatment of osteoporosis should be taken off those medicines at 5 years after you've been on them for 5 years. Why? Increased fracture rates noted by endocrinologists nationwide. Okay? So if you've been on those type of medications, you need to come off of them because of a high rate of fracture and death of the mandible. The mandible literally dies. And the dentists are just all upset about it because the doctors refuse to take these patients off their medications for their, quote, osteoporosis. Problem is, what options do you have? Boron. Okay, zinc won't do it. Okay, yeah, sorry. So how much boron should we take and what supplements? So the answer is we need to take, on a daily basis, all of you should take at least 30 milligrams a day. That's the dose of an average Israeli citizen in Jerusalem or Jericho is about 30 milligrams a day. If you got osteoporosis, then we'd up the dosage to 75 milligram or even 150 milligram, okay? Can you use something called borax? Borax is the salt of boron, and you can take like 1 teaspoon of borax in a quart of water and drink it over 2 days. However, borax for some people gives a bad case of diarrhea. So, you know, boron is a lot easier to handle than the borax, okay? Foods that are high in the United States with boron, the food would be dates. Dates out of the Mojave Desert, out of Southern California. The dates are loaded with boron. very few foods outside of dates have a lot of boron, just because there's no boron in the soil of North America. Okay? We use a complete micronutrient fertilizer for the garden. Do you see this sufficient for nutrient-rich food? You know, the problem is I don't know what they're doing with boron, so for nutrient-rich food. So, you know, there was a gentleman here who just told me that he added some borax to the soil around his tomato plants, and his tomato plants grew extremely big, and his tomato plants are still producing large amounts of tomatoes even at this point. Who was it that told me that? Would you just stand up and tell us that?
Yeah, I put two things on my tomatoes this year. One, I put molasses.
Hold on for a second.
I put some molasses in water, just 3 or 4 tablespoons in water, and dissolved it, put it around. Then I put just borax around my tomato plants, and they grew to about 9 feet. I staked them up, and they just grew over, and now they're back down to the ground. So they're, in plant-wise, it's probably 16 feet of plant, and they're still producing 3 or 4 tomatoes. But I got more off of those 4 tomato plants than I have off of 15 tomatoes in the past. So I had one other question about the amount in the borax. On the internet, it mentions for arthritis and stuff. You take 2 teaspoons of borax in a quart jar, and then take 2 teaspoons per meal is the way they suggested to take it for arthritis. Not to drink quite so much as.
That's right.
Maybe then you wouldn't get the diarrhea.
You can try that and seeing if that'll help, okay? That's a poor man's way to do it, but it may work, and if so, go for it. I'm sorry? Yes, every day. Because boron is water soluble, so if you 90% of the boron will be out of your bloodstream within 21 hours. So you got to take it every day, okay? He was using borax, okay?
It has 11 or 12% boron in the borax.
You can get 20 mule team borax, and that's about the 15%.
At any grocery store, right?
20 mule team borax is boron. It's a part of boron. It has boron in it.
Now, there have been people who have been asking about bioidentical hormones. As you recognize, there are hormones that are coming to us from animal sources. To give you an illustration, there is a estrogen called Premarin. Premarin comes from pregnant horses and pregnant horse urine. And Premarin contains like 18 different estrogens, of which only one the body can use. There are 17 estrogens in there the body cannot use, and yet these estrogens will stimulate you like estrogen will in the horse, and it'll turn many of you women into heifers. So, and that's a real problem, because the problem of gaining a lot of weight in the presence of estrogen. Estrogen it's a weight gaining agent, and so it's better to take the natural estrogens that we can now synthesize, and they are natural as compared to the estrogen of Premarin. It's really interesting to me that with all the data that's out there about these estrogens, that gynecologists continue to insist on giving Premarin. And to me, that's a travesty. And so, and gynecologists will not listen to you when you try to tell them to get off of it, because this is the way it's always been, this is the way it always will be. And I'm sitting there saying, and that's how you're going to lose patients, because patients are becoming educated to the fact that these things are causing problems with breast cancer, uterine cancer, etc. So Someone was asking about homocysteine and how it's related to heart problems. That's for a topic for a different lecture. Our daughter is 29 years old and has lupus. She is taking prednisone. Would like to start a family. Should she be taking boron? As you will see from the next lecture, one of the lupus is probably one of the most easy diseases to treat. And it's because in medicine, we have totally ignored certain hormones, such as if I said to you, do you have adrenal insufficiency? Well, the vast majority of doctors would say, I have plenty of cortisone, as if the adrenals only make cortisone. The adrenals make 26 different steroids. And cortisone is number 3 on the list. Number 2 is pregnenolone, and number 1 is DHEA. And what's happened is that we have majored mentally, medical doctors have majored in the minors, and they forgot to major in the majors. Which is to say, the primary steroid coming out of the adrenals is a hormone called DHEA. They sell it at the health food store here in town, at the Village Market, okay? Over the counter, non-prescription. And yet DHEA, if you will go to Google and type in DHEA, lupus, Stanford Medical School, you will see the articles that have now been published showing that DHEA cures lupus. But doctors, what do they do? What do you see here? You got lupus, you need prednisone, you need cortisone. Cortisone is the wrong, it helps to suppress an overactive immune system, but the problem is it's lack of DHEA that's got this disease that's causing the problem. You give DHEA to these girls with lupus, here's their lupus symptoms, here's their DHEA levels. You bring their DHEA levels up, their lupus symptoms go right down. It's been published. People are not paying attention to their own medical literature. That's the problem, okay? So, once she starts taking DHEA, she can start taking boron. And the other thing is that, here's a good question. She's got lupus. She wants to start start a family, okay? Folks, one of the biggest problems that we've seen, especially in Adventism, because many of you are vegetarian, is a lack of iodine. Iodine deficiency will give you decreased mental function. And in fact, for those of you who are school teachers, you will know that we saw this problem up here at Mount Pisgah Academy up in Asheville, that at Mount Pisgah, the teachers all told me that they saw an increase over the last 10 or 15 years. They've seen an increase in attention deficit disorder among the kids coming into the academy. And they're wondering, what is going on? We've never seen this before. We've been teaching for 20, 30 years, and we've never seen it this high. It's because they took the iodine out of the bread, and they started only giving you iodine in the salt. And then all you granola girls here have been cooking with salt that's made from the ocean, sea salt. You know what the problem is? There's no iodine in sea salt. And because the girls are cooking with sea salt that contains no iodine, you need iodine for a developing fetus to give you a genius. And and the Japanese people are eating, because they eat a lot of seaweed, a lot of fish from the ocean. The Japanese, our intake of of iodine is like 13.8 milligrams a day. And the Japanese have have the highest IQs of all the people in the world. And lack of iodine to our children gives a problem known as attention deficit disorder. And many of you are being affected by this disorder because it's prevalent within our society. We've taken the iodine out. Number two, when you go to cook with regular salt, 50% of you are cooking with salt that contains no iodine. So where do you plan to get your iodine from? You know, you should be getting it from iodized salt. And even at that, it's very, you know, I'm from the School of Public Health, and we were teaching people to stop cooking with salt. So where are you guys going to get your iodine from? And you know what? We have never taught a cooking school that says how to cook with sea vegetables. We're good at teaching you how to cook with land vegetables and turn you into vegetarians, but we've never turned a single one of you into a marine vegetarian. We've never taught you how to cook with sea vegetables. Does that make sense? Yes, sir. This is the defect in our thinking. Yes, ma'am.
The Himalayan or the real salt, is that better
Contains no
Okay.
iodine. Now, you have hypertension, you have high blood pressure. It is better to cook with sea salt than regular salt. Sodium chloride. Regular salt will push your blood pressure up. Sea salt is made out of 15 different mineral salts from the ocean, and sea salt will not increase your blood pressure. So all of you with hypertension, you're going to cook with salt, use iodide, and they do make it iodized sea salt. Okay? No, because there's no iodine in pink Himalayan salt. Celtic salt, there's no iodine in that salt. The lecture is iodine tomorrow. I'm just prepping you for tomorrow morning.
Tomorrow is the topic on iodine.
So we'll
I'd
cover
encourage
that
you to
one
come.
tomorrow. We need to finish off with boron. So how much boron per day? 30 milligrams a day, okay? If you've got osteoporosis, increased arthritis, increased joint pain, etc., go to 75 milligram until your joints calm down, okay? And if you have osteoporosis, like my wife, we went to 150, and then we're going to slowly try to wean her down, to get her away from the boron. But it's not hurting her at 150 milligrams a day, okay? And personally, I take 30 milligrams of boron per day, and I have the skeleton of a 20-year-old. Okay? And I'm 65. Does that say anything about how long I plan to stick around? I think that's it.